When you are always having severe pains during your menses, during your menstrual flow, then you should know it's not normal. And I'm going to be telling you what can cause this particular condition in this video. Because I see people saying it's a thing that will go on its own or it's a normal thing. There are people who are not having this problem. So why should your own be different? You should know you are having problem and you need to manage it when it's still at early stage before it gets to an advanced stage. Most of these issues are just things that are showing you signs. And when they get to an advanced stage, and that's why some of you, when you marry or when you are about getting pregnant, you find it very difficult to get pregnant because you might have been having signs when you were still young, but you neglected all these signs. And one of these signs is severe pains during your menstrual cycle. And I'm going to be telling you what can happen to you, what can cause this particular kind of problem. Number one, if you're having a condition called endometriosis, then you should be expecting pains during your menstrual cycle, because endometriosis is a condition whereby the endometrial tissue grows outside the uterus, and when it grows outside the uterus, it can cause severe pains to you as a woman during your menstrual flow. And if you're also having a condition called PID, pelvic inflammatory disease, a condition whereby all the tissues of the cervical floor becomes inflamed, including your VG, your cervix, your uterus, your fallopian tubes, and other ligaments and muscles that has to do with your pelvic floor, they become inflamed, they swell up. This particular condition can cause so much pain during your menstrual flow. If you're a woman that also have fluctuation in your hormonal cycle, your progesterone hormone is fluctuating, your estrogen hormone is fluctuating, your prostaglandin hormone is fluctuating, all these particular hormones can make you to have severe pains during your menstrual cycle, and you need to have yourself checked. So you will not have yourself to blame when you are about having a baby or when you are pregnant, because it might make you undergo miscarriage when you are pregnant, because hormonal imbalance is something that does not leave you alone. It stays in your body when you don't manage it early, and that's why you need to have yourself checked in case you're having any of these signs and symptoms I've just explained, so you will manage them when they are still at early stage. So if you enjoyed this video, do well to share it to your friends. Also follow my page, because these are the kind of videos I'll be making every day. And if you have questions you wish to ask about this, do well to drop it in the comment section, as I'll be responding to them as soon as possible. Thank you for watching this video. I'll see you next time. If you are always having pains during your menses, then you should know it's not normal. Because I see people always saying menstrual pain or having severe pains during your menses is something that will go in when it comes and goes, and it's just something they should just overlook. You shouldn't overlook this kind of problem, and that is why I'm making this video, so I can tell you the major things that can cause this problem, so you will know the best time to visit a healthcare provider in case you're having this kind of problem. Number one, if you're having endometriosis, this particular condition is a condition whereby a tissue grows out of the uterus. The endometrial tissue grows outside the uterus, and this particular condition can cause pains during your menses. Pelvic inflammatory disease, a condition whereby all the organs of your pelvic floor becomes inflamed. Both the muscles, the ligament of the pelvic floor, they all become inflamed. Your VG, your uterus, your cervix, your fallopian tube, other organs that has to do with your pelvic floor. As a woman, you'll be experiencing severe pains there. This is all linked to PID, and you need to treat it in case you are having this kind of condition. For people that are having fluctuation in their hormonal cycle, you are having fluctuation in your progesterone, your estrogen, your prostaglandin, all these hormones can make you have severe pains when you are in your menstrual cycle, and you need to make sure you have yourself checked before it gets to an advanced stage. Aside from this, you might also be experiencing skipped menses and other problems that have to do with your menses aside from the severe pain you are having. That shows you have a serious problem you need to handle. It's not a normal thing. Don't just overlook it, because if you overlook it, you might have problem when you want to conceive, because hormonal disorders or hormonal imbalance can make you not to get pregnant as a woman, and it can even make you to undergo miscarriage when you become pregnant as a woman. So that's why I said you need to manage it when it's still at early stage before it gets to an advanced stage. All disease conditions in the body can be managed when you notice them at early stage, but when they get to an advanced stage, they become very hard to manage. So thank you for watching this video. Make sure you have yourself checked, and if you have questions you wish to ask about this particular condition, do well to drop it in the comment section so I can respond to you as soon as possible.